very much. So we turn now to item 6 on the agenda, which is the paper relating to a healthy NHS workforce. Ian, please, would you present the paper?
Thank you very much, Chair. The Forward View committed us to getting serious about prevention, and employers have a critical role in that. Employers in society at large, not just in the NHS. But if we're going to encourage a wider drive here, we need to focus on what's within our gift within the NHS in the first instance, and that's exactly what this programme is about. We have 3 aspects to it. We have our plan to develop a nationally specified occupational health service for GPs, with PHE, a drive to raise the standards of food and nutrition in the NHS, and then thirdly, a major new programme to improve NHS staff health, where we have selected 10 NHS partner organisations who, in a style and an approach that is analogous to the way we're working with our Vanguard sites for new care models, will work as a group to develop a core recipe of replicable approaches that are then capable of wider spread, that they can, of course, add to. And I commend this programme to the board.
Questions and comments, please. Moira.
It seems to me, Malcolm, that obviously we're an employer, and it's right, as you said, 5-year Forward View committed us to being better at these aspects of being an employer. But we're also a kind of initiator and supporter to other bits who are employers in their own right, as it were. And I just wonder where our kind of overlap with Public Health England. Is it doing more in lots of other spaces with lots of other employers? I'm thinking about social care, again, as you might imagine. We're always talking about health and social care, but social care is always the poor relation in this. But is there something, for example, that public health is doing that I can be more relaxed, that they're being, it's not NHS England's kind of territory, but it's very appropriate for them?
I think your point is very well made, Moira. There is both the challenge around the wider care system, not just the NHS, and indeed what we do with employers more widely. We're acutely mindful of both of those elements. This programme, this first step, is a narrower focus on how we work with NHS employers. We have been developing this with PHE and the other national arm's length bodies as a national programme. I would see this as the first step rather than the last word, and then clearly the challenge for us is how we build on this and spread it more widely.
Big picture, because we have a tax-funded health service, therefore we neglect the workplace as a place for health improvement. And it's a good thing we've got a tax-funded health service, but it does mean that for the 30-odd million working-age adults, actually, despite the fact that since 1998 we've been talking about workplace health settings, actually not very much has happened. So it's hard for the NHS to really become an effective advocate and partner until we've begun to put our own house in order, hence the initiatives that Ian has described. But to your broader question, Moira, frankly, there's a lot more that we want to do with employers and with unions and with businesses, many of whom are running excellent programs, but in their own particular settings. And so the debate that we're having with some of the big employers' organisations, with the TUC and others, is how do we really kind of put those kind of approaches on a much broader footing, particularly for employee groups at greatest risk. Paradoxically, often it's white-collar employers who are most expansive in their offers in this space, and actually we've also got to look at retail, manual occupations, hospitality, various other places as well. So there's quite a bit of work going on behind the scenes on what this might look like, including whether we could even contemplate fiscal incentives in some regard for credentialed workplace health programs, where there's quite a good evidence base now, not just around some of the mental health and stress-related aspects of this, or MSK, but other pieces as well. So it's a work in progress. It's a huge opportunity for us, I think, if we look out over 5 years. There are things we're doing to try and connect the health checks programme that Public Health England is running with the workplace, the diabetes prevention programme that we're kicking off with at-risk individuals in some of these settings. And I think just by, frankly, getting the national conversation going, we're putting more kind of fuel in the tank on this one.
Victor?
Part of my question been partly answered. I was just wondering about whether organisations outside the NHS and in the not-for-profit sector might join this list of organisations that are trying to do this work and learn with you. Because I think there are organisations, not least mine, that would really benefit from this, and you could benefit from our learning today. Why wait? My other question was more about, there are some sections of the NHS workforce that appear to have greater challenges in a lot of areas than others. So it's one of the reasons why we've got the Workforce Race Equality Standard. We know there's a direct link. So I was just going to ask a question about how we're using that initiative, which you've led on, Simon, which is good, to sort of add value to what we know and how we might intervene in workforce in places where NHS staff work.
Thank you, Victor. If this programme is successful, then the 10 partner organisations that we're working with will need to adopt an inclusive approach, and they'll need to think about how they reach all of the different staff groups, including people who have typically got higher levels of stress, grievances and so on. High levels of stress and grievance and so on. So I think you're right, Victor, to highlight the connection between the two initiatives, and your suggestion and point about making sure that this is not a narrow, tightly drawn, closed cohort of 10, but part of a wider movement where we can connect to voluntary sector organisations and indeed sow the seeds of wider spread is also something that we will need to build in.
Yeah, and I mean there are quite a few, like the City Mental Health Alliance is a good collaboration. The Sunday Times, a number of the national papers kind of run sort of competitions in partnership with employers on this. Sally Davis has been leading a bunch of work in this area, as has Carol Black. NHS employers are pretty engaged. So I think there's kind of, we're definitely less than the sum of our parts in terms of the action that's happening nationally, and it hasn't had the oomph that it needs. So this is partly about trying to kind of mobilise those disparate efforts.
Karen?
I just wanted to provide some sort of assurance to the board as well that we're taking it very seriously inside NHS England, particularly, and already in a way in advance of this being announced, had quite a lot of work in place with our active workforce campaign and training programs for mental health in the workplace across the organisation as well. So I just really wanted to provide you with that reassurance that we're doing our best to lead the way in respect of our own staff.
I think ensuring that at least one of the lists in Skipton House is always out of action
definitely helps.
is a very powerful starting point.
Exactly. And the other two are the world's slowest lists.
Yes.
But it does actually in Skipton House have a sign at the left telling you actually, recommending walking, which we don't have here.
Right. Any further questions or comments for Ian? No, well, I think, look, we note the paper, but also I think we take it really seriously. Something that the board is utterly committed to. And if we can't care competently and adequately for the health of our own employees and for those of the NHS more generally, then it speaks volumes about what we're able to do in the wider community. This is a real test bed for us. So thank you, Ian, very much for that.